Sharon, have you ever seen anything like this virus, the coronavirus, COVID-19, in all your days?
No, no. I actually thought about this the other day when I first graduated. I went to London and worked as a locum doctor over there, and and as a doctor you're meant to be calm and you're meant to know what these things will hold. Well, about that time it was the start of the HIV epidemic, and I think there was fear then. Um, it was nowhere near as infectious as what we're going through now, obviously, but it was something that we didn't know um, how to deal with at the time. And certainly back then there was no known medication. I mean, the amazing thing, if you see the journey of HIV, was that it struck down many people, and there were many of the same emotions that we see around um, this virus in regards different nationalities and that sort of thing. There was that same behaviours that it brings out in people, but a lot of that comes from fear, and that's where we have to listen to the really good advice. But I remember at the time myself as a doctor being quite nervous because you were looking after cases, and we weren't 100% sure on the virility of the virus. And then there came a cure, which was a great day. And in fact, when it came to HIV, the management, particularly in those countries that could afford it, changed overnight. And so, we'll get to that same place with this virus.
In terms, Sharon, of the basic steps that we've been told about by governments and authorities, etc., washing your hands, keeping your distance, what is the idea of that? Is it about trying to stop this virus in its tracks? Obviously, you hear the term flatten the curve. Can you explain a bit more about that?
Yeah. So this virus spreads generally by droplet spread, by respiration, by breathing, coughing, sneezing. And that droplet spread, or that breathing, obviously also rests on surfaces. So the distance that is given generally that you'll hear is 1.5 to 2 metres, which is for general normal breathing. When it comes to exercising, because I'll jump into that straight away there with that, people talk more about 4 metres. So when you're breathing more heavily, there's a chance that respiration can go a further distance. So with exercising, you need to think about 4 metres. When it comes to surfaces, we contact those all the time. You'll read little bits of data everywhere about how long this virus survives for, and I'm not an infectious disease expert, but even from infectious disease experts, I've heard anything from 4 hours to 6 hours to 9 hours to 14 hours. So I think we need to think about that as we need to treat all surfaces as infected, and we need to treat every part of ourselves as infected. And if we do that, then we have the opportunity to stop the spread. And that means that when we're at home, we know that once we enter the home, if we clean our own hands, then our own home, if we're cleaning it normally, is not going to have the virus. But it's when we leave the home, and I know that everyone's at different stages of lockdown, but if those of us that are still able to leave the home, every surface that we touch could have the virus on it. So as you can probably see in the background, I'm in my consulting room. So as I entered the room here, I've got like some wipes, and I wipe down my telephone, my computer mouse, my keyboard, and the bench surface. If you're going to the supermarket, it means you know that when you hold on to the trolley, there's another surface we touch when it comes to door handles. So we know that touch. And then what is the problem with the hands is that before we even think about it, we take our hands to our mouth, to our nose, to our eyes, so to anywhere on our face. And so that transfers the virus. The other thing we do is that we then take food. So again, food to mouth. So that's the surface. And then, as we said, the distance is around stopping that respiration. So when we breathe, those droplets with virus in them, they will go that distance, but they will fall to the ground with gravity. So if you maintain that social distance, we're not going. And when it comes to flattening the curve, your second part of the question, that's a lot of that's firstly about overwhelming the overwhelming that occurs in the health system. So what we want to do is be able to provide the best care for all those people that require any form of health care or hospital management. And so if we let the virus take off, our healthcare will be overwhelmed. And as you hear that people will need to make decisions about those that we would normally, with the good healthcare that we have, we would normally be able to treat and manage. So what happens is your mortality has a risk of increasing. So I feel like it's almost like we starve the virus of the opportunity. So, you know, a simple thing is if I stay in this room and no one comes in here, I'm not going to get the virus. So if we maintain that distance, if we decrease our numbers, and if we always wash our hands, then we will starve that virus of an opportunity to travel to the next person.
Yeah, and it's good to get that kind of clarity. In terms of players, and obviously you've worked with a lot of players in your 20 to 30 years in medicine, what would your advice be to players now in the professional ranks who really don't have much to do at the moment?
Yeah, I think that's one of the hardest things. And the same goes for all those athletes that have just now found out that the Tokyo Olympics have been postponed. We all know the athletes' reason for being is their sport, is their exercise. So what has happened is that they have had that removed from them. So it's the same as anyone that loses their job. It's actually one part of our reason for being. And so it's devastating. It has a significant effect on their well-being and their sort of worthiness. Like, you know, they're obviously being encouraged to maintain a level of fitness, but even then they have to train at distance. And most of these women and men are all, you know, team players, and they enjoy the camaraderie of the sport they're playing. And so you've now taken a team player into almost isolation, and they have really very few goals because no one knows when they will resume playing again. So their level of anxiety and mental health and wellness will take a significant knock. So in a funny sort of way, I feel that where they need to perhaps look at changing their goal towards the greater good of, which we all need to see, is the greater good of the world and your country and everyone around you. So what they're being asked to do is about saving the health of the nation.
What about things that they can do at home in terms of wellness, Sharon, and mental health, and even down to things like watching the news and social media and not always scrolling through your phone, etc.? What's your thoughts on that?
I think probably restricting that looking at the phone is really important. It sucks you in, and, you know, particularly all these, I'm sure you're watching yourself, all these epidemiological curves and numbers, and you know, we all can be totally overwhelmed by that. I think you use the same rules that we tell each other to use all the time, like restrict your use of the phone, find a time in the day that you're going to look at it, but find other things that you can do. And that might be, you know, reading a book sounds silly in this day and age, but we might all find the pleasure in reading a book. We're going to have time to find the pleasure in reading a book. Exercising, if you're allowed to exercise outside, not only share work routines, share some humour. Like, I think laughter is both exercise is medicine, but laughter is also a really good form of medicine. So I think if you can communicate through a WhatsApp group. The other thing about athletes is they love a challenge. So I think I saw somewhere about the toilet paper roll challenge. Like, any of those little challenges keep people going. Athletes love numbers. So if one person's doing better than the next one, we've got to create competition within our own home. So, and then obviously food, like we'll get drawn into perhaps not always eating the best food. So trying to maintain really healthy food to boost your immunity, lots of fruit and vegetables if you can. Again, getting creative about perhaps being a good cook at home, finding different challenges in our life. I know it's hard, but those are the things I'd be thinking about.
And finally, Sharron, just to, I suppose, end on a positive note, there is that old saying, this too shall pass. I mean, I think both players and the general public like to hear a bit of reassurance, because the hope is that this will pass.
Yeah, I genuinely believe it'll pass. I've talked to numerous infectious disease consultants, and SARS did exactly the same thing. It did pass. It was nothing like this. We're putting, every country is putting in the right measures. It's our cause now. We know what to do. We just need to do it, and it will pass. It will pass. We'll beat this. It may take. It's going to take some time, and each country seems to be on its different journey. But certainly, talking to all the medical personnel, they genuinely believe that we will come to the end of this. And as we were speaking before, there are going to be some parts of our life that we're going to find a lot more fulfilling than perhaps we did in the past. Just those simple pleasures like looking outside and seeing a nice view and those sorts of things.
Dr. Sharron Flahive in Sydney, thank you very much.
Thanks.